Good afternoon, everybody. Welcome to our media update for COVID-19 in Eau Claire. We're glad you joined us again. This is our chance to give an update to the community on where COVID-19 is, what is happening currently, and give an opportunity to media to answer some questions. We're happy that you're here today. It is Thursday, September 24th. First of all, I'd like to say that I am joining you today in a room by myself, so I'm able to have my mask off. We're going to try this approach with Janessa supporting me today in a different room, and she'll be joining if there are questions in the chat box to share those with me. But we're going to try that to see if it's a little bit easier to have our conversation and answer questions with me not wearing a mask in this format. It is hard to believe that it's already Thursday and the end of the month almost. So this month again is going quickly and there are many things happening. Our next briefing will be in October, next week, Thursday. So we'll go through data, we'll share a couple of the usual updates that are happening, and then we will get to questions. First, at a state level, the data that we typically share, we'll share again. That is our negative counts of testing. So our tests that have resulted in negative counts are at 1,371,070, an additional 66,346 negative test results since last week's report. We are now at 108,324 individuals in Wisconsin that have tested positive for COVID-19. That's an increase since last week, Thursday, of 13,578, an increase of 23,092 since yesterday. Those case numbers are rapidly increasing across the state as a whole. Of the individuals that have been hospitalized, 6,897 of them, of the positives, have been hospitalized, an increase of 375 individuals since last week. 1,265 individuals have died because of COVID-19. That's an increase of 34 Wisconsin residents that have died from this disease. Again, across the state, numbers are increasing rapidly. Wisconsin is being seen as a hotspot for rapidly increasing case numbers. It's certainly something that we don't want to be happening right now. Our hospitalization rates are increasing rapidly in many parts of the state. We are watching that for our part of the state. And we're seeing large spread of cases across all age groups, but particularly in that 18 to 24-year-old age group across the state. Again, this isn't a disease that really impacts just one age group. Anytime an 18 to 24-year-old gets COVID-19, they spread to their close contacts, and those close contacts are people in all kinds of age groups, and we're seeing that in Eau Claire as well as across the state. Again, concern related statewide to the rising hospitalization rates. We are getting reports from all regions of the state of some level of concern, both with staffing related to COVID-19 because of the staff members who are isolated and quarantined related to COVID-19, and with increasing hospitalization numbers for people impacted by COVID-19. Again, this is a lagging indicator. That really means that that's a data point that is of the data points most concerning, because it means that we are at a place that we need to really pay very close attention to what's happening. Our early indicators related to testing and related to our positive case numbers are important and critical, and we'll keep tracking those, but certainly hospitalization rates are also critically important. The state 7-day positivity rate is now at 16.9%. Again, a rapidly increasing positivity rate. In Eau Claire, we are at 21,415 negative tests done for Eau Claire County residents. 774 tests since last week, Thursday, are being reported on our website right now, which is data pulled from the state. We do know that we are continuing to have a data challenge related to our negative test results. This is something that's happening statewide and in the first weekend of October, so not this weekend, but next weekend, they're doing a fix to the data system that hopefully will help us get those negative test numbers more rapidly downloaded to the county where those test numbers should be. Because those negative test numbers are not being downloaded to the county rapidly because we're focusing on our positive cases, our negative numbers are not exactly where they should be. We do have, on average, when we look at the broad state report, probably about 2,500 tests in a 7-day period happening in Eau Claire County. UW-Eau Claire is doing a significant number of tests, so that 2,500 number is a higher number than we've had over the course of the summer for the number of tests done per week. Positive cases in Eau Claire are now at 1,734 for today's report, an increase of 398 individuals in Eau Claire County who have been COVID positive. 57 cases a day is the average for the last week. This is the highest single caseload that we've had to date. That number is critically important for us to pay attention to. On our dashboard, you'll see, and these dates are slightly different, the dashboard will show 367 in those past week period. Our positivity rate is at 14% for this last 7-day period. Again, concerning numbers. Many will say that we should expect these numbers to increase and that it's not a big deal if we have this many people COVID positive. And I would remind everybody that the challenge that we have is as this spread increases, it will impact populations that will be hospitalized and will die from COVID-19. And we're seeing that in other parts of the state, as I said earlier, and it's really what we're working hard here together to keep our schools open, to keep our businesses open, to not have people isolated and quarantined in the numbers that we are seeing now, and to slow the spread, to not have that second circle of spread go beyond the close contacts. Since September 1, 72% of all cases were in that 18 to 24-year-old age group. Again, many people could have the story or the narrative that that's a small age group, it's not a big deal, but those are individuals that are working in our businesses, that are in our community, that are caring for our children, that are working in daycares and nursing homes and in other settings across our community. And the spread is happening from there out to the other age groups. So if you watch our data closely, you'll see that not only is our 18 to 24-year-old age group having increasing cases, but all of our age groups are because of that spread. To date, of the cases that we have had since 9/1, when we've been tracking, about 42% since the beginning of September of our cases have been connected with UW-Eau Claire. Again, the vast majority of these are off-campus students. Of our cases, those positive cases of COVID-19, 1,433 have recovered. 301 Eau Claire County residents are actively being worked with and isolated today. Ever hospitalized of that group is 50, and we've again had 6 deaths of Eau Claire County residents because of COVID-19. Again, our goal is to continue to keep those numbers of hospitalized and those deaths as low as possible. It's a success that our numbers are that low. It's a prevention success that we are all doing those critical things to protect people in this community. And I really commend people for all the work that they're doing while our case numbers are going up, but our hospitalization numbers and our death numbers are staying low. And that's exactly our goal. It's a good thing that they are there. We also report once a week on public health investigations. The Department of Health Services on their website is listing 24 active investigations for Eau Claire County. Our measures show 17 new investigations of those 24 in the last 2 weeks. Of the 24 investigations, 9 active investigations are related to long-term care facilities. Again, a number of those because of a younger population that is working in those settings. And if there's one case in a long-term care facility, it is considered an outbreak. Other settings are at 9 for outbreaks. Our workplace outbreaks are 3. Our educational facility outbreaks are now at 2, and our group housing outbreaks are at 1. The state lists Eau Claire County at high activity level. In fact, all counties across the state are at high activity level. Eau Claire County is considered one of the top counties for cases in the state. You'll see that on our website on a map that we are one of the red counties for total number of cases now. And we are considered by the Harvard model looking at disease and where the disease trend is going, and our state model at actually being at the very high activity level, even though reporting at the state level only goes up to high. Every Thursday, we share with you the testing data at the jail as one of our populations that we are particularly caring for. The lack of disease spread there is critically important. There are now 144 individuals that have been tested connected to the Eau Claire County Jail, with still 8 positive cases, all 8 of which have recovered. Again, a testimony to slowing disease spread in congregate settings. A couple of updates for you. The mask order was extended by the state. The governor declared a continuing public health emergency, citing the record number of cases that we're seeing across the state, as well as the rapid transmission in school settings, both K through 12 and higher ed settings. And the fact that despite it still being our summer, early fall months, we have for a respiratory disease, a lot of cases and a lot of deaths. So again, something to make us all pause that we are not in our classic respiratory disease months, which are our winter months, and we are seeing higher than even a typical flu season cases, fatalities, and hospitalizations with this respiratory disease. Executive order continues to be in place for wearing face coverings, so that has been extended for those over the age of 5 in public spaces. We have really strong support across our community for use of face coverings, and you'll see that there have been recent messages that are strongly sent out from our Chippewa Valley Economic Recovery Task Force and many, many other partners around the importance of wearing face coverings. This is not going to prevent all disease. It is not a mask that will stop disease transmission entirely, but it certainly has been shown as an evidence-based way to decrease spread at a community level. If we all really lean into wearing face masks when we're out in public, we really will see slower disease spread. So it's something we can do for each other. It's something we can do for our businesses and our schools, and something we can do for our family members. The slower disease spread happens, the more we will be able to stay on top of this and keep life as normal as possible. So our continued ask as a community is for people to really take it seriously, not because there's a public health order from the state, but because it's the right thing to do. And we can do it as something that is showing that we care about having life as normal as possible in this community. The order does go into effect, it is in effect now and is in effect through November 21st. We've had lots of questions about Halloween. It's our next holiday coming up, shortly followed thereafter by, at least if you're a Wisconsinite, gun hunting season, and then Thanksgiving, of course. But Halloween questions are abundant. People concerned about Halloween and people wanting to have some Halloween traditions continue. As a parent of 4 children who, when they were young, competed to see how much candy they could get between the four of them. I understand how this is an important tradition in all communities. It's a way for us to connect with one another. State guidance came out related to Halloween and trick-or-treating last week. We've shared that broadly. CDC has also shared guidance that is available at their website. Both websites have good information. We've been doing public messaging about this already, and we'll continue to do that. Again, the biggest concern with any event like a Halloween holiday is that large gatherings and closer than 6-foot contact will increase the potential of spread of disease. Our strong encouragement is that people find ways to celebrate that don't involve large gatherings and don't involve close face-to-face contact with individuals. There are creative ways to still have some Halloween celebrations happening, and we know people are working through how to do that, and we support that. But we really ask that you find creative ways to do Halloween slightly differently this year. Don't invite big groups of kids into your home if they stop and ring your doorbell, and spend a lot of time talking with them. Really make sure that people are not congregating together or big Halloween parties not happening. Really make sure that you are doing things to slow spread with this event. Again, going to our website at the Community Events tab and looking there for some basic safety precautions is our recommendation. We hope that people find ways to be creative and have fun and also stay safe for Halloween. I'll share with you a little bit about the measures that we track every week and that we use as we make decisions here locally, but we know a lot of other people are using as well. Those measures will be posted shortly to our website. It's our kind of red, yellow, green way of giving a sense of what's going on in the community. Our case counts are over the last 14 days are at 666, the highest caseload to date for our 14-day case counts. Our outbreaks are at 17 in the last 2 weeks. Again, our highest level of cases in that 2-week period, that are 2-week outbreaks that we've had in a 2-week period. So 17 outbreaks in that 2-week period. Our community spread indicator is at 34%. So 34% of individuals that come down with COVID-19 of our group do not know where they got it. So we are having spread happening where it's not a family member that you were in close contact with or another very close contact that you can say, I was in close contact with that person during their infectious period and now I have COVID-19. Almost more than a third of the people in our community aren't in close contact with someone that they can recognize. It does mean that we need to do more testing and we need to do a really good job keeping close contacts, identifying close contacts, and then keeping them quarantined. Our positivity rate now correlating with the state positivity rate calculation is at 14%. It is in the red. Again, as I said, the state positivity rate is also high and continues to go up. Our case contact measure and our contact tracing measures, 2 measures to say, how are we doing with our public health work, are both challenging this period of time. Both of them are indicators that we should all care about, because if we are not making sure that our cases are isolated quickly and our close contacts are quarantined quickly, we will have more spread of disease. Our 24-hour ability to reach cases is now at 78%. That has been challenged recently. We certainly want to be in touch with people that are positives much more quickly than that. That's impacted by a number of factors. First of all, our high number of cases definitely impacts that. We've had an overwhelming number of cases, as you can hear. Again, in a 14-day period, to have the number of cases that we have had, or the 7-day case count, is really an enormous number for our agency to be handling. It's also, though, because people are not always answering their phone and not always cooperating with talking with us when we call them about being a positive case. We need people to answer the phone so we can do that immediate isolation and the discussion about close contacts. More concerning is our close contact number. The percent of people that we reach in that first 48 hours for close contacts is now at 19%. That number is concerning for a number of reasons. First of all, it's happening because we are in crisis mode and we are first prioritizing getting to our cases. Once we talk to that case, we are having them identify all of their close contacts. For those household close contacts, we are asking the case to tell the household close contacts to quarantine and to their other close contacts to quarantine. We are contacting the close contacts that are high risk. So those individuals that are connected to our K-12 school system, those individuals that work in healthcare or long-term care facilities, or in our other facilities where we really need to make sure that they are staying home as close contacts. It isn't the best practice that we would like to be doing in public health, but because we are at the place we are with rapid spread, it is what we are doing at the moment. If someone tells you that you are a close contact and that you need to quarantine for 14 days, we need you to quarantine for 14 days. If there's a reason that you doubt that, please call our COVID hotline. We will talk you through that and verify that you are a close contact. But we really do need you to make sure that you are quarantining. You may get called by a K through 12 school. You may be called by UW Eau Claire or CVTC, and you may be notified by the actual case that is telling you that you are a close contact. In the last 2 weeks, we've had almost 1,100 close contacts named, despite our crisis level of care. So many people are close contacts of cases. We also need you to understand that if you are quarantined, it's a full 14 days that you need to stay home and not go out at all. The reason for this is really simple, but it's a hard thing to follow. It's simple because the truth is that we have a disease that you may become a positive if you are a close contact anytime during that 14-day window. It may be at day 1 that you are a case because you now have COVID-19. It may be at day 14 that you are a case because you are COVID positive. But anytime during that 14-day window, you could be a positive. Getting a negative test at that point in time, at any point in time during your 14-day quarantine, is not a pass to stop quarantine. It's just that at that point in time, the test doesn't show you are a positive. Someone recently said to me, it's kind of like a pregnancy test if you do it too early. If you test for pregnancy too early, it may not show that you are pregnant when you actually are. You have to wait until the time frame is there that actually shows that you are pregnant. We need everybody to stay quarantined for 14 days. That's really the practice and the requirements that we have under quarantine and isolation for this disease. Again, our hospitalization metrics this week will again look good. It is a very positive result of the work that is happening across the community to contain disease. We want to keep it that way. In our region, over the past few days, we are seeing concerning levels of hospitalization, and the reports from other regions are really concerning, and we're watching those closely. So again, the metrics are showing that we have a lot of cases, that our public health system is overwhelmed, and we're working through that. Across the state, this is also true. It's not unique to Eau Claire. Secretary Palm described this in a 1 p.m. briefing today, that this is expected when we have more people out, and with schools starting and with interactions happening, we need people to understand the implications of this. And this is our first line of defense. We've been successful to date because of a really strong public health response to this disease and all the work that all of you are doing. Losing the battle there will be a challenge for all of us and for all of our businesses and schools, and we need to pay attention to that. This is a disease that not like like every other disease, whether it's TB or measles or sexually transmitted infections or even influenza. If we're doing the things to prevent spread, it's kind of invisible. People don't know that we're doing that work. It's when we have public health breakdown happen that we all see in the community the problems. We would rather be invisible. Public health would rather be in that invisible role, doing the prevention work, making sure the numbers stay low, than in the role of saying to you today that our numbers are high and they are growing rapidly. We hope that everybody continues to work with us on that. A couple of other things that we want to share is that we are really working with our schools to make sure, again, that disease spread is slow. We are working with healthcare to make sure that the disease spread is slow. We need teachers and nurses and physicians and our providers to be working. We need them not slowed down because they are COVID positive or their family members are COVID positive. And we need our community to work with us on that. Again, how do we slow COVID-19? We keep our circles small. We keep 6 feet distance with people whenever that's possible. And again, it's possible most times. We make sure that if we have symptoms that we are staying home and that we get tested right away. We make sure that we're wearing a mask when we're out in public, and we just make it normal for all of us to have those shared practices. The more we support each other, the more normal it will be that we're doing those things. So I'll start with a couple of the questions that came in advance, and then I'll count on Janessa sharing any new questions that come in. First of all, there's a question about the number of tests being done daily in the county and where that is and whether we're satisfied with that. Again, with our positivity rate staying high and with our case numbers going up, we really do need more testing happening in this community. We're getting a lot of new tests coming in because of UW-Eau Claire, and that's a good thing. But across the community, we are really working on ramping up our community testing. We're partnering with healthcare on that, and they are working with us steadily to make sure that they have ability to test individuals that are symptomatic and close contacts through their healthcare systems in the ways that they usually work with all of us as patients. We are also working to add community testing sites and have done some of that already. You've heard about that previously, but we're adding more locations for general community testing. Chippewa Valley Free Clinic is one of the sites that we have identified as a location where we are partnering with the Free Clinic to work on testing in a way that people can come in and get that free testing in an easily accessible way. It's not within the Chippewa Valley Free Clinic building. We're working with them during their kind of off hours to do it within their parking lot and in their awning space to do the testing. We do have a testing event coming up Saturday morning at Chippewa Valley Free Clinic, and again on Monday afternoon this coming week. Please do know that those testing sites are available to people, and you can check our website for more information. We also are working with the Wisconsin National Guard. The state released on Wednesday a plan to bring the Wisconsin National Guard out to all parts of the state. Every region of the state will have assigned wing teams, Wisconsin National Guard teams, to work on outbreak testing as well as fixed site testing. One of the fixed sites in our region will be a 3-day site, and we are anticipating that being actually in Eau Claire, in the Eau Claire area for the region, but certainly will be an amazingly positive resource for people living in this community to get testing, free testing with a simple sign-up process. It also can be walk-in testing at that site, and we will have that available 3 days a week, including a weekend date and some evening hours. We'll have more information about that hopefully early next week with a start date identified and information about how to access that site. So again, right now, Chippewa Valley Free Clinic site, an upcoming wing site, Wisconsin National Guard site, and then all of our healthcare sites working in partnership to make sure that we have testing happening in a rapid way. We are also regularly actively working on outbreak sites to make sure that we have testing quickly available for the close contacts, and anybody else that may be symptomatic connected to our outbreak. So if you hear about a place where we are doing some outbreak testing and you either live in that neighborhood or that community, or you are connected to that site, please take advantage of getting tested. We need people tested to slow this disease down. We also have a question about an update on trick-or-treating, which, again, that question I think we already answered, but DHS did put information on their website, and CDC also has information on their website. And as I said, we have local information, and you can check out our social media sites as well as our website for information about Halloween. We additionally had a question related to contact tracing metrics. Again, as I said earlier, our contact tracing metrics are concerning again this week. They were as well last week. And really the question asks, what are we planning to do? Are we adding people? How are we dealing with that issue? I'll add a little bit of additional content to what I shared earlier. We have added additional contact tracers to our team, and they are up and moving, up and ready to respond to cases. We have also brought back some of our health department staff that were providing some contact tracing work, but moving back to their other positions as environmental health inspectors and in other roles. They are taking some of our surge right now because we have so many cases. We're hoping that that decreases so they can go back to their more normal activities. We are also partnering with UW-Eau Claire, who has been doing a lot of the contact tracing work on campus, to add some contact tracers, and they are doing that now, adding contact tracers to do additional contact tracing of our UW-connected students. And we are meeting with CVTC to consider ways that they can help support contact tracing. Additionally, we work with all of our K-12 schools as we have cases of COVID-19 for the schools to help with us doing contact tracing. So again, if you get contacted by a health department contact tracer, a school connected contact tracer, or a UW-Eau Claire or CVTC connected contact tracer, work with them. Stay home and be quarantined if you are told to quarantine. And then again, if you have questions about this, you're always able to call our COVID hotline, and that's that 715-831-7425 number. Again, we have really strong partnerships, and we're finding creative ways to lean into the fact that we need to find opportunities to manage this disease as best as possible. So I'll ask Janessa if any questions came in through the chat.
There are no questions in the chat box today, but is there anyone on this call today that would like to unmute themselves and ask Lisa a question directly?
All right, hearing no questions, I will just again remind you that we'll be back next week, Thursday. Do go to our website, covid19eauclair.org, as a resource for all of the data that I just shared with you, to get all of the resources that we have at that site under the various tabs as described earlier. And again, if you have questions, please call our COVID hotline. We'll be back next Thursday, which will be October. Thank you very much.